Hello and welcome. I'm Sarah Overmall, a healthcare reporter at Politico. I'm pleased to welcome Senator Bill Cassidy, a Republican of Louisiana, to the Harvard Chan studio. This conversation is part of a series called Public Health on the Brink, which explores the most urgent challenges facing public health, as well as promising solutions. And Senator Cassidy, I'm personally very happy to be interviewing today, being both a senator and a doctor. I'm hoping to draw on your experiences in both of those areas. Thank you for being here.
Hey, I'm very honored to be with the Chan School of Public Health at Harvard. So thank you for having me.
Great. Well, starting on a very timely topic, I'm sure that you have seen the draft opinion from Justice Alito that would overturn Roe versus Wade. You yourself have described yourself as, quote, unapologetically pro-life. If that is indeed the final ruling, many states, including your own Louisiana, would immediately ban abortion, yet women would still be able to travel to other states to terminate pregnancies. So starting on the federal level, do you support a federal ban on abortion that would apply to all states?
Let's get some context, okay?
Yeah, okay.
First, we don't know that's going to be the final decision. And I say that because everybody is a little bit breathless about it, but we know that decisions change up until the week of. Secondly, I'm unapologetically pro-life. You mentioned that I'm a physician, and every physician knows, but also almost every person who has access to an ultrasound picture of the child within the womb knows that at some point the child becomes a child. And there is somebody who you can imagine has distinct civil rights, human rights. By the way, that is not to say, oh my gosh, what a difficult situation, because obviously it's the mom who is carrying the child. And the vulnerability of somebody who's frightened, who doesn't know what to do, can only be fully understood by that person. So we have to have compassion for all parties. Secondly, we have to realize that if, just again for context, because Sarah, you brought to this question a lot of pre-knowledge, if you will, that this would allow states to make their own laws. And so, for example, New York and California would be as liberal as they are currently liberal. And states like Mississippi, by the nature of this, a mom would have access to first trimester, but not after the first trimester. All that's still in the case. And we also know that pills could still be mailed through the Postal Service to somebody who wished to have an abortion in the first early part of her pregnancy. And that could be done at home, and it'd be very difficult for states to restrict that. So I think that fundamentally, the first month or two, probably not much would change except the location of where the abortion would take place. I'm right now not describing my emotions about this, my feelings about it. I'm just being totally analytical. And so when folks think it's Armageddon, oh my gosh, everything bad is happening, I think you've got to put it in context and understand. Now, that said, I am unapologetically pro-life. That child is a child, and you have to recognize that. But I'm also a federalist. And I do think that states should be allowed to make decisions by the tenets of democracy. Now, practically speaking, even if you attempted to do something on the federal level, it would take 60 votes in the Senate, and there's probably not been a pro-life. There probably just could never be 60 pro-life senators that would vote for a ban. So you're offering me a theoretical, and I'm giving you the reality. But I can also refer back to my kind of principle as a federalist. So a long answer to a short question, but I felt important to give that context.
No, I appreciate that context. And surely, as you say, it would be pretty unlikely that that would happen on the federal level. But you did set up the next thing I wanted to ask. And as a leader in the pro-life movement, as we mentioned, as a physician, what do you see as the next steps in pro-life care if Roe is overturned? And, you mentioned earlier abortion pills. I believe that you've spoken out against mail order abortion pills or wanted more controls for those. Do you see those being an important part of this going forward?
Well, I think they're going to be a part of it. I think the FDA, in a political decision, decided not to monitor side effects afterwards. And I do think that was a political decision, not one that was guided by the potential risk. But that said, again, whatever I think about it, it's going to be part of it. So there's two aspects of this. It's what is the reality and what is one's personal feelings. And there is a reality here that there's just a reality here that's just going to be part and part of this. So we could keep on beating this, but I think we kind of defined it pretty well. I guess if you were to ask me in a summary what I think next steps are, there's a lot of people who are undecided about this issue. And I truly think that we need to support the mom when the child is in utero, and need to support the mom afterwards to give her everything she needs so that she can feel comfortable bringing the baby to term, and either offering the child for adoption should she wish to have the child offered, not to keep the child, or if she wishes to keep the child, help the child keep the child, help the mom keep the child. So if you will, could support that continuum of life from within the womb to without the womb. There's a lot of parents out there who would love to adopt a child. And I think once moms know that there is someone that would love their child, should you bring them to term, that can change attitudes. And perhaps lastly, I will say it's important to note as well, the frequency of abortion is now less than it was in 1972, substantially less. And so society, if you will, has become increasingly pro-life, less likely to have an abortion, if that's how you define pro-life. So if we can keep that trend, hopefully some of these discussions will be different in the future.
Last question on this topic before I move to the pandemic, but because you raised maternal care and the importance of, caring for a mother throughout pregnancy and childbirth, I know that Louisiana ranks very low or I should say very high on maternal deaths amongst the states. So what do you think needs to be done there to improve that, especially if forms of abortion or birth control could be limited in the future?
I'm not sure people are talking about limiting forms of birth control. And shall we say, if you're using abortion to limit maternal death, that's kind of an odd way to approach the problem. But anyway, that said, Louisiana, about a third of our population is African American. African Americans have a higher incidence of maternal mortality. So if you correct our population for race, we're not as much of an outlier as would otherwise appear. Now, I say that not to minimize the issue, but to focus the issue as to where it would be. For whatever reason, people of color have a higher incidence of maternal mortality. Now, to be sure, there's different definitions of maternal mortality. Sometimes maternal mortality includes up to a year after birth and would include someone being killed by her boyfriend. So in my mind, it's better to restrict your definition to that which is perinatal, if you will, the time just before and in the subsequent period after she is delivered. Now, there's different things we can do about that. I have something called the Connected Moms Act. My women, I think I remember correctly, that African American women have an increased incidence of preeclampsia, but it doesn't matter. If you have a poor public transit system, a mom who is dependent upon it lives 20 miles away from the doctor, and she's got hypertension just before she delivers, you'd like a way to better monitor her than asking her to come to the doctor's office every 2 weeks. So what we've proposed is the Connected Moms Act, which allows remote monitoring of blood pressure, teaching the mom how to check for protein in her urine, other things that might be a marker for complications of or progression of preeclampsia. And then if the mom has an issue, you can send the ambulance to the mom or the home health agency to the mom. We also have the Maternal Health Improvements Grant, which again is to promote studies of this issue, as well as to look as potential remedies, if you will, if there's racial bias that's discovered in how healthcare is delivered. So we've got a couple things that we're floating out there trying to take care of this issue, because it is an issue for us in Louisiana, as well as for folks nationwide.
Absolutely. And speaking of something that is an issue nationwide, as well as Louisiana, the COVID pandemic. So moving to that subject, you broke with others in your party last year by supporting the right of local offices to make their own public health decisions. For instance, whether to impose a mask mandate. And you had this quote on CNN at the time, quote, "Whenever politicians mess with public health, it doesn't work out well for public health." So what do you mean by that? And could you share an example?
Well, Politicians, whenever you politicize public health, whenever you politicize anything, it becomes more about politics than the subject of which you originally started. Period. End of story. Now, public health, ideally, you have a public health officer who is closest to the ground, and she can look around and see what is needed, what is necessary. I think it's a good conservative principle that he or she who governs closest to those governed governs best. In this case, the public health officer working with the mayor or whomever would be making those decisions. If you have somebody who's subject to political motivations or who is unaware of a locality's particular circumstances, then that person may make a decision which is not best for the public health here. That's just kind of my observation as a physician, but I think it's borne out in my observations as a senator.
Kind of on that note, we've seen public health really take a beating during this pandemic. There's been a loss of credibility in some respects, a loss of trust. So what steps should elected officials or public health workers be taking to restore that credibility?
Well, the CDC, it just has not performed well. And they continue to undermine their credibility by, for example, I still don't know if people are showing up to work at CDC. I really don't know that. And
wait, what do you mean by that? Like physically to?
Yeah, like in work. Like I still don't know they're showing up, okay. Which is amazing because you have people in a lab, and this isn't like you can work at home remotely looking at lab data. I'm going to do an analysis and write a paper. No, it's like being in a lab with specimen, wearing PPE, knowing that everybody has been vaccinated, and knowing that everybody in Fulton County is back to work. But I'm still not sure people at CDC are back to work. Now, when you begin to think that the folks who are making the policy don't seem particularly concerned about the example they set for the rest of society, yes, it is safe to go back to work. That in of itself calls into question credibility. What else can you say? Aside from the kind of mixed messages that were continually kind of pushed out, and I could go down the list. We know it. It's a tired list. We don't need to review, but it's just been a bad time for public health.
It has. And kind of following off of that, looking forward from this pandemic, you've proposed establishing a permanent emergency response fund that could be used to respond to future health emergencies like another pandemic, so agencies do not have to wait for congressional appropriations. First, could you walk us through that proposal a little bit?
Yeah, so think about Zika. Maybe it's easier to think about Zika. And there was the first cases in Brazil, and we knew that it was beginning to come here. A Honduran woman with Zika infection had come to New Jersey and delivered her child, and the child was terribly deformed. And we knew that we had the mosquitoes in the Gulf Coast that could harbor the virus, and that they wanted emergency money to spray to kill the mosquitoes so that we couldn't get the Zika. And we also knew that it was spread sexually, so there's other ways to go. So Congress had to kind of fight for several weeks to get the money required to do all the interventions to head it off at the pass. Now, we don't do that with hurricane recovery. Recall after Hurricane Katrina, Congress, I wasn't in Congress then, but Congress had to meet and actually appropriate the dollars for the relief of the people who didn't have water sitting in the Superdome. So Congress said, wait a second, this is not right. Let's just set up a standing fund so that if there's a disaster, FEMA immediately has something to draw from. They don't have to wait. Day one, they can bring relief. Similarly, it seems as if that paradigm would work for public health. We have Ebola that has just come from Liberia, and we know we need to protect. We know we need to track where it's going. So let's have a public health fund that we can draw from. So Ebola shows up in Dallas, boom. Everything we need to do is track and trace, and you name it, we have done to keep Ebola from spreading in our country. So it just seems a more forward way. We have a paradigm by which it works, that with FEMA, and it also just seems like a kind of stitch in time saves nine sort of approach as well.
So how do you think something like that, had it have existed when the coronavirus pandemic began, how do you think it would have made a difference?
Well, that's an interesting thought experiment. I say that because I'm not sure the absence of money was the initial problem. I think the absence of imagination recall that we had public health officials in the national level of the United States saying, "Don't worry." When I was at Mardi Gras, and later on there was a huge outbreak associated with people that had brought the coronavirus to New Orleans, and then from New York and Seattle, and then took it back from and from there it spread. And Louisiana was an early hotspot. And I think it was, frankly, because we were seeded by people coming in from Mardi Gras. Now, that was after we were told, "Don't worry." So I think there was a failure of imagination of how quickly it would spread from Wuhan around the world, and the travel patterns of the United States setting it up perfectly to do so. Now, frankly, in fairness, it may be that elected officials would not have been able to understand it sufficiently to stop congregate events. So I'm not saying it's all to blame on public health. I think there's a whole kind of like, okay, yeah, sure, right. I've never seen it before, so I don't believe it. Among those that had the ability to call off these events. So a kind of a failure of understanding of imagination of all involved.
It's interesting you mentioned Mardi Gras, because I remember talking to you actually at the Senate about a week before lockdown, and it was you surrounded by a bunch of reporters discussing how this virus may be transmitted to other people, and a week later, no one was leaving their homes.
Right. Isn't it something?
It's pretty wild to think about, yes. But I do also have to ask, I mean, what do you think the likelihood is that something like this preparedness fund could be passed? Because I have to say, we do suffer from a lack of imagination when it comes to disasters and pandemics, but we also never really seem prepared. We often do the response rather than the preparedness, and have a lot of apathy for funding something that might not happen.
Well, I think that now I'm going to speak about some of my frustration regarding CDC. It's going to take both credibility and advocacy among our public health folks. I will say, when Republicans were in the majority, and I'm sure that I paid more attention to it, but I'm sure it's continued, we really funded NIH. We really funded NIH. We did a pretty good job of CDC as well. Why? Because we could see Alzheimer's coming down upon us. We could see cancer among us. And we said, we need to fund a lot of study in neurologic, a lot of research in neurologic issues, a lot of cancer studies. These are future causes of morbidity, mortality, high expenditures. So there has been some proactive nature, but it was the awareness of the issue that moved policymakers to it. It's not accidental that the funding bill for neuro research was called the Johnny Isakson bill. Johnny Isakson, the popular senator from Georgia who had Parkinson's, lived bravely with it. But his example of stutter stepping all the way down the hallway with that kind of Parkinson's gait was a reminder to us all of this issue. Now, we need that advocacy, dadgummit, from the public health agencies. One example, and I'm just still frustrated by this. When I was in the House, which is about 10 years ago, CDC came to testify. And at that time, we were aware of how we were tracking everybody around the world that were terrorists. And I think this was Zika. If not Zika, there was another virus. I forget, maybe Ebola. And I said, why don't we have the same sort of tracking for germs and for bacteria and viruses that we have for terrorists? We know that if, let's just pick Zika. We know that if there's Zika in the South Pacific and workers from the South Pacific are coming to Brazil to work on the Olympic structures, and they have the insect in Brazil, which could harbor this virus, and then there's going to be lots of people coming from around the world to Brazil, shouldn't you be able to track that? You should be able to get ahead of that. Now, Ebola in Liberia is another great example. If there's a breakdown, where will those travel patterns go? To me, it just makes all the sense in the world. So when COVID breaks out and one of the people from CDC comes to testify, and either I raised the issue or he raised the issue, goes, but imagine it was he. Oh yeah, I remember when we discussed this when you're in the House, we're still working on it. Now that'd have been 8 to 10 years. Wait, 8 to 10 years, like you're still working on it? Also when it broke, the CDC said, well, I'm still frustrated. You know, why don't we have the information systems in which we can track where the infection is happening in real time instead of getting data like 2 weeks later to see where it once was? And we could actually track data from the labs around the country to say where there was an outbreak. And this is where we still had the imagination, where we still thought maybe we could control it. Oh yeah, that's a great thought. That's a great thought. If we get $500 million, maybe we can do that. So Congress gives them $500 million. They farm it out to the states, and they don't build up their internal capacity. Now, eventually, that was corrected. But there was just a kind of behind the eight ball, always kind of, if they were on, they would defend themselves, I'm sure. But the reality is that there's not been advocacy for this sort of data system upgrade that equipped us to be able to take care of it. And I would argue that when Congress is aware of something, when people bring it to them and make the concerted case that this is a priority and it's going to help in the future, Congress will fund. But if you don't bring the data, if you don't make the case, you can't blame Congress. Maybe I know about it, but Johnny Isakson is a realtor. And Johnny Isakson, the realtor, is going to be thinking about real estate issues, financial crises, not healthcare crises. So I've been a little bit on a rant. I apologize.
No, well, that actually spun another question into my mind, because as you talk about this need for data modernization, I know that the Biden administration has asked for, I believe, I unfortunately don't have the number in front of me right now, to modernize CDC's data, to improve surveillance, to do some of the things that you're talking about, like recognizing a virus's spread sooner, at least in the country, if not globally, because I can't imagine what kind of money would be needed for that. But would you support putting in the next fiscal year budget more money to do this, to help CDC fix these data problems that this pandemic has indicated there are gaps in?
First, the CDC's gotten about $1 billion plus already to update their data systems. Think about that, $1 billion plus. I happen to speak to some of the vendors that serve the CDC. Is this an adequate amount of money? Yes, it is. Now, I don't know what they did with it. CDC needs to come and actually, and Dr. Walensky, to her credit, saying that they've got to kind of go in, do a deep dive, see what's wrong with the CDC. Reform is maybe not the word she used, but that's how I framed her remarks. So in credit to Dr. Walensky, she recognizes that there's an issue. But before we throw more money at an agency, which I still don't even know if they're physically in their workplace, when they've got PPE and they've all been vaccinated, when we talked about things, I talked with them 8-10 years ago. We're still getting to it. I think I would have to personally be reassured that we're just not throwing good money after bad. We should fix the leaks in the bucket before we put more water in. And believe me, I used to do work with CDC. I did actually have hepatitis B immunization vaccine programs and attended conferences there, got high regard for them. But right now, I just have no faith in what they're doing.
Well, I feel like we could be on this topic for a very long time, but I do want to touch a few other ones with you. Another very, very big one on a lot of people's minds right now is mental health. You've worked to expand mental health care, including pushing for parity laws that would require insurers to treat mental and physical health claims equally. We know the Labor Department has stepped up enforcement, but patients say there still is no parity. Meanwhile, employers complain that they're being targeted for systemic problems like a shortage in mental health care providers. So what do you see as the next steps to enforce parity laws and also just ensure access to care, improve access to mental health care?
Yeah, so first, going back to advocacy, whenever I speak to a group, wherever I am, I always say that there's somebody in this room, including me, that everybody in this room, including me, has been affected by somebody with serious mental illness. It may be a family member, it may be a friend, it may be that person you went to high school with whose promising future never realized, and you later learned they died under a bridge, homeless. Now, that is not rhetoric, that is reality. And I find that when you frame it that way, people come to the table looking for solutions. Now, parity is an issue. Medicare does not have parity, for example. Whenever folks want Medicare for all, the mental health advocates will say, wait a second, Medicare doesn't have parity. And so maybe we should fix that first. So I do think we need to work on parity. Chris Murphy, a senator from Connecticut, and I are right now, I think yesterday, reintroduced the reauthorization of all the bills, of all the language that we did in 2016. Now, the employers actually have a point. You shouldn't penalize them if there's not a provider. Okay, I'm supposed to cover adolescent psychiatry, but there's a shortage of adolescent psychiatrists. I'm supposed to be able to pay for these hospital admissions, but like there's no hospital beds because we have an IMD restriction. So I do think that we've got to patiently work our way into full realization of parity. Bringing people along, recognizing that parity can actually save businesses money. By the way, as an aside, when Bill Clinton, I think it was Clinton, instituted parity in the Federal Employees Health Benefit Program, there are studies that show that it saved money within the first year. That saved money, real dollars. It saved money relative to the increased cost. Well, you've got to bring payors on to know that. We live in a democracy, and if you throw too much at them all at once, they're going to push back and you're going to lose the ground that you've been able to gain. So if we can educate, advocate, and bring people to the point where they understand that this is actually good for their bottom line, then I think we can get to where, and then build out the resources so that the vision can be realized, we'll get there. Won't happen tomorrow, but I think it can happen within 5 years.
What, in your view, is the single biggest obstacle to improving health and healthcare in the U.S.?
Yeah, the major stakeholders all take their bottom line first before they take the patient's needs first. And you have to kind of get them all in a room where they all give enough to where their bottom line is protected, but they all have to acknowledge that the patient's well-being is the first priority. They all are going to give lip service to that patient well-being being first priority. But if you look at where they spend the money, it's easy to imagine that it's making their bond payment, or it's paying their staff, or it's a new drug development, all of which is good. But if you have a drug which is priced so expensively that someone cannot afford it, it is as if that innovation never occurred. I could keep going, but if we, as a physician, I would say if we make the patient our primary perspective, priority, and then work everybody else so that they can protect the bottom line, but maybe they give up a little bit, then we can actually get some good policy. One more example. We actually did that with surprise medical billing. With surprise medical billing, we actually accomplished that. And so we actually know that that can work.
I'd love to continue on that, but I know that you have to go. So thank you so much, Senator Cassidy, for being here. It was really an insightful interview.
Thank you, Sarah.
Thank you.